With that being said, please, those of you who are new, come learn, jump onto our other webinars. We do record all of them, so you can go back and view or listen to the previous webinars. But we just want to be a resource for you. More than anything, we want to be a place that you can come and learn, grow, and build your career. So with that being said, let's jump into a brief overview of the ACA. How about it? So what is the ACA? The ACA was passed in 2010 to make healthcare more accessible and affordable. The Affordable Care Act, Obamacare, Marketplace, those are some words you may have heard. It created the health insurance marketplace. And beyond that, it prohibits denying coverage for pre-existing conditions. Someone stated I am echoing. I've never heard that one before, so hopefully that's just um, something on your end, Gary. I apologize, everyone, if I am echoing. Let me mute and unmute here. Lynn said you are good here. So Gary, it might just be something on your end, brother. Thank you. We create ACA created the health insurance marketplace, and it prohibits denying coverage for pre-existing conditions. That may be one of the biggest indicators, or one of the biggest perks and benefits of the marketplace is the denying of pre-existing conditions. I don't know how many of you are in the space already, but there was a day once where people had to typically wait 12 months, 18 months. Some just didn't cover pre-existing conditions at all. Um, Funny story, my wife, she was offered coverage and it did not cover any pre-existing conditions. This is through an employer, and she was pregnant at the time. And so her pregnancy would not have been covered. So pretty crazy, but the ACA is here to fix those types of instances or those situations. So that is the ACA, a brief overview. Core goals of the ACA. Biggest ones you'll see here on the chart is going to be access. The goal of the ACA is to expand access to people nationwide, improve the quality of care. A big one is that pre-existing conditions we talked about. Protect patients from unfair insurance practices and provide financial assistance to help make coverage affordable. So the ACA is a great place for most. Big place for those who are self-employed, those who are maybe in a lower income bracket. Um, Regardless, it's a good place to be. It's a great place and a great product to have to serve as an agent. How the ACA works. So clients will shop for plans on healthcare.gov. EDE platforms, that is just a direct exchange platform. If you've heard of a platform called Health Sherpa, if you're brand new, you may not have. Health Sherpa is an enrollment platform directly integrated with healthcare.gov, typically the most common platform, or state-based exchanges. The state exchanges, that is just directly through each state if they're not an FFM state. If I'm confusing you, since this is a very elementary program, do not worry. We'll have more information later. It is based on income and household size. Based on that income and that household size, they may qualify for premium tax credits. You may have heard of subsidies before. What that means, if a plan is typically, let's just use easy numbers here, $500 a month, and it is a household of two, and their income bracket falls in the qualification for a premium tax credit, they may only have to pay $150 a month rather than 500, depending on what they qualify for. Plans are standardized into metal tiers: bronze, silver, gold, and platinum. Bronze plans, these plans typically cost less per month, excuse me. They generally have higher deductibles and they generally cost more when you use the plan. A bronze plan would be great for someone who's generally healthy, doesn't typically go to the doctor frequently, but they just want some sort of coverage. Next up, you have what's called a silver plan. These plans typically cost more than bronze. They will generally have lower deductibles, lower max out of pockets, and they typically cost a little bit less when you actually use the plan, use the coverage. Gold, obviously, if you can tell the way we're going, this scale is essentially just crossing each other. Gold and platinum, you're going to pay the most per month. You're going to pay the least when you use the plan. Those are for people with very high doctor visits. They're planning on a big surgery, whatever the case is. That's where that solution comes into play. Some households qualify for what's called CSR, or cost share reductions, which these are really nice. They go hand in hand with the silver plan. They lower copays, deductibles, and other out-of-pocket costs, usually making silver plans a very strong value option. So if you have clientele on the lower income bracket, a silver plan with CSR is a great solution. Really lowers their healthcare costs and needs. If you're completely new to ACA and you've never signed into Health Sherpa, I'd recommend just going to their quoting site, quote out some plans, get a feel for yourself and see what it looks like. It's awesome. Comes down to here. Income household size determines a subsidy. Based on this, you know how much they're qualified for and eligible for. And then you'd go into a plan selection, help them find the right plan for their needs. What ACA plans cover? All marketplace plans are to cover the 10 essential health benefits. That is one, outpatient care. This is in no particular order. Two, preventative care wellness services, prescription drugs, hospitalization, maternity and newborn care, pediatric services, including dental and vision, rehab services, emergency services, lab services, and mental health or substance abuse services. Those are all meant to be covered under the ACA. Up here, most health plans cover a set of preventative services like shots, screenings at no cost to the client. Every plan has what's called preventative care,